Welcome back to the Best PT podcast. This is episode 24, talking about infection control. Some common signs and symptoms of infectious diseases: fever, chill, fatigue, rashes, skin lesions, bleeding from the gums, that's never good, joint effusion, diarrhea, urinary urgency or frequency, new onset, cough, sore throat, nausea, vomiting, headache, stiff neck, or muscle pain with new onset, convulsions or confusion, tachycardia, and hypotension. Standardized precautions when working with every patient: wash your hands with antibacterial soap, wear gloves, mask, and gown. That's a great way to build patient rapport, is to wear gloves, mask, and gown with every patient you interact with. Airborne precautions: use a private negative air pressure room with a double door seal and an antechamber to dress in. 6 to 12 air changes per hour in the room. A respirator must be worn. This is commonly used with diseases like measles, varicella, and tuberculosis. Contact precautions: the patient should be in a private room unless the roommate has the same infection. Use gloves and wear a gown if you'll have very close contact with the patient. This is used with diseases like MRSA, C. diff, Ebola, herpes, and generalized skin infections. Droplet precautions: the patient should be in a private room unless the roommate also has the same infection. You should maintain 3 to 5 feet from you and the patient and wear a mask. This is used for diseases like the flu, mumps, and rubella. Donning and doffing sterile garments: you should put on your gown first, then your gloves, then your cap and mask. Touch only the inside of the gown and use the sleeve cuffs of the gown as mittens to open and don your gloves. And sterile fields: remember that edges of all packaging become non-sterile as soon as they're opened. Sterile gowns are only considered to be sterile on the front side from the waist up. Never turn your back on a sterile field. Any items that are below waist level or fall below waist level are considered to be contaminated. And do not talk, sneeze, or cough in a sterile field until you're fully dressed. That's it for episode 24, talking a little bit about infection control. Episode 25, we'll talk about accessibility. As always, the outline will be in the show notes. Thanks for joining.